Good day, and welcome to the SNN.Network Summer Virtual Event. Our next presenting company is Wellteq. It is now my pleasure to turn the floor over to Scott Montgomery, CEO of Wellteq. Sir, the floor is yours.
Thank you very much, and welcome everyone. Thank you for your attention this morning. I'm here to talk about Wellteq Digital Health. It is one of the world's leading digital health and wellness platforms listed on the CSE in Canada and the OTCQB in the US. And when we say world, it is a global digital health proposition. We have a disparate team spread across the US, across Canada, across Asia and Asia Pacific, and we're deploying to corporate customers in over 30 countries. So we're an enterprise solution with a corporate wellness background, with a formative team in excess of 100 years in the space, myself personally coming up to 20 years, having already built and sold a corporate wellness platform or corporate wellness company into an exit. Our founding partners have industry experience across technology and IoT specifically into commercial, and we're bringing these combined capabilities into the healthcare sector, a $10 trillion opportunity that is in drastic need of some digital transformation. We have momentum coming into the mid-year of 2021 with 120% year-on-year SaaS revenue increase. So we've got a fantastic foothold for a very exciting couple of quarters and beyond ahead. So without further ado, I'll head straight into who we are and where we're heading and the problem that we're solving. So ultimately, there are 4 levers in the behavioural system that are causing nearly 3/4 of the US healthcare expenditure. And those lead indicators are poor sleep, poor activity, poor nutrition, and poor mindset. And these culminate in chronic illnesses such as diabetes, metabolic syndromes, mental and behavioural health, addictive disorders and dysfunctions, and they're causing an unnecessary strain on a very stretched healthcare system. And at no other time comparative in modern day history is we in more need of health professionals to be freed up for people who need this for more acute conditions rather than chronic care. So our solution drives towards these lead behaviours. Those behaviours are leading us to become more stressed, more sick, and ultimately bringing more burden. And the paper-based, siloed, locked-up information with a series of health professionals that have to re-ask and re-ascertain some data on an episodic basis in drastic need of some digital intelligence, for some smart intelligence to come in to healthcare. A, for diagnosis, B, for an earlier intervention, but C, and most importantly, once we have someone in that system, we need to coach them on an ongoing basis, specifically towards an outcome that's meaningful to them. And that's where technology comes into play. So the Wellteq ecosystem spans a continuum of care. Our history, and of that nearly 20-year operating history, works within corporates. And these are big, large employers, multinational employers and SME businesses around the world where they're offering a smartphone application experience to their employees to coach them towards better health. So the solution works in a preventative and a proactive manner to help keep people away from an insurance claim or a chronic behaviour that may lead to an illness or an injury. As technology, sensor technology and data science has increased the sophistication of what we can do, we're able to help prevent some quite specific causal factors. And these may be things like heat stress, fatigue, excessive weight and behavioural issues and towards mental health that are causing a disruption in culture and absenteeism rate and claim frequency and duration, which are ultimately costing corporate payers money and creating a cost burden which is unsustainable for an entire ecosystem, which I will get to shortly. As our business expands and through our development lab in Colorado, we have a hardware capability which is coming in to open up the sophistication and the intelligence in the virtual care scenario. So working with partners to bring an informed telehealth console. A telehealth customer for us is both a supply partner to extend the virtual care consultation, but also a customer. And then right into the deep elements of virtual care where we're working with, we'll be working with more the therapeutic and the condition management end of the spectrum, where the clinic relationship between a physician and a patient has now been extended into a remote environment where your home becomes a treatment arena. The aspect around the pandemic that has brought to us the necessity for a digital proposition or a digital and at-distance relationship between a physician and a patient is the start of where we need to go. So bringing that distance has been facilitated by telemedicine, and it's a fantastic start to our journey of digital transformation for a more informed or more intelligent healthcare. However, it is merely the beginning. So what we are doing here as an industry is we're bringing far more than doctors on Zoom calls. We're bringing intelligence and continuous monitoring and supported prognosis and diagnosis capability through technology, through data science and computer science, and putting that in the hands of physicians so we can bring a more healthcare-focused consultation, taking that administrative burden of record keeping away from that physician. And this is the momentum that we are on as a sector, is to bring more connectedness through the Internet of Things, Internet of Medical Things, more intelligence through the data science and the AI and machine learning capability, and then into a more personalised coaching or proposition at scale on an ongoing basis. And this is where Wellteq comes to the platform. So we are a digital health platform paid for by employers, paid for by insurers, and paid for by healthcare providers, offering this healthcare, virtual healthcare at scale. And we focus on the 4 behavioural pillars of health and wellness, and we bring into that an Internet of Things capability into a networked offering. So very simply, the user experience for us, if you're an employee, if you're an insurance policy holder, and in very short order, in time as a patient to a care provider, you have a smartphone access, and we profile you through an omni-channel continuous data collection, more than questionnaires. It's more than wearables. It's partner-driven, so we're taking in passively collected information, and we're profiling you as an individual so that we can then serve you coaching that is very specific to your goal or your desired health outcome. And this is all digitally driven. We do not have people on phones coaching people through these behaviour change programs. This is algorithmic. This is totally digital, therefore scalable, and that's why we can deploy at a multi-country and multi-language level with a very, very small and lean team. Through that data footprint, we offer different engagement exercises with individual programs, with team challenge and group experiences, with your personalised coach, with rewards and incentives. And this is more data capture for us to then offer a prognosis or a health risk assessment to the individual. And at that point where those risks are deemed imbalanced, we can make a referral or facilitate a telecare consult into one of our partners. And that is an extended level of care that captures a lot of data that for a corporate payer, we can then, in a de-identified and an aggregated fashion, very important, no individual information is passed back to a corporate. At a group level, we can offer very, very insightful customer or population insights around sleep, around stress, around absenteeism, around claims distribution, and that can help a workforce planning function of an organisation strategically mitigate costs and risk in a workforce. So some of those use cases are around the individual, and they can be in a holistic health experience where we're looking at physical desires and needs, where we're looking at mental health desires and needs. Stress, anxiety, we've seen a rapid rise in COVID-related anxiety and depressive disorders, and self-harm, domestic violence, substance abuse for emergency medicine admissions. Then we've got the employer who is trying to figure out how do we support our teams of people in this unprecedented time when we can't see them, when we can't be close to them, and we need to offer a digital portal or digital gateway to not only information but to support. And then that helps reduce cost and risk, and that's very, very important to insurers as well. And we've got some fantastic evidence to support that the return on investment for employees and for insurers specifically can increase lifetime value of an insurance policyholder if you're using wellness tools from over 13 years, and each of those years can have a hospitalisation cost reduction of 30%. So we're helping people live longer and they're less costly. That's fantastic business, especially for insurers, but for employers as well. There's a load of evidence out there from a range of NGO bodies and from academic institutions in and around the need and the returns for digital health propositions in this time of a pandemic. Nearly 1 in 2 employees have reported a decline in mental health, and that's impacting every single family and network around the world. We need to provide tools to help cope and help get ahead of this risk. The benefactors of a solution in reducing this risk and reducing these burdens are many and multiple. There's a very clear benefit for the individual from improved quality of life, health risk profiling, performance at work. That transitions into the employer and then out also into the insurer from a cost-benefit relationship. Ultimately, we can reduce the cost and the service burden of the healthcare system and share that across multiple countries. Now, this is not theoretical. We have done this in over 30 countries around the world across almost all industry types, and we're quantifying behaviour change and health improvement outcomes across the behaviour-based disorders. And we do this for big organisations, global financial institutions, wearable manufacturing organisations, construction firms, insurance companies. We're providing the solution to people in all sorts of vocations around the world and helping to improve stress, helping to improve activity, nutrition habits. We had a very recent result with Southeast Asia's largest bank where we helped increase their sleep minutes by 34 minutes per night over the course of a sleep-focused program. So we're getting fantastic results. And then the quote there around demonstrating how big organisations are leveraging technology to help understand and improve those risk profiles. From a distribution faction, we have a reseller network which has big corporate brands such as Willis Towers Watson, such as Garmin, such as NAVCO, which is the exclusive reseller of Garmin down in Asia here. And these companies sell Wellteq into their corporate customer portfolios. Multi-billion customer portfolios are being recommended Wellteq by their Asia Pacific sales force currently. And then we have our white label partners. So those are the top 2 logos of 2 of the largest 3 health insurance companies in Australia, and they white label our technology for their policyholder network. So we've got great distribution and channel functions from a customer acquisition perspective. Now, where we are different is that we are in a world where we arguably have the most multicultural and diverse set of markets on the planet. So based here in Singapore, which is where the company was founded, has been forced into understanding the different preferences, interests, and requirements for multicultural, multi-language, or multilinguistic capabilities to engage people around health behaviour change. And so in 12 languages, over 30 countries, we have a digital solution going out to many and multiple employees in almost all sectors. And this makes it very scalable to a very diverse workforce, especially as the office or the work environment has now expanded back into our home. So we need that digital function. Thirdly is we are truly a digital proposition. So we're not putting people on phones. We're not putting people inside workplaces. This is totally scalable. So our ability to maintain high gross margins in the 70s towards an 80% GM is already at play. Where we extend our continuum of care is through our hardware capabilities. So we've got a smart hub which has the ability to compute voice, to compute information through clinical software and interoperability functions, and then facilitate the capture of information from over 500 medical and clinical connected devices into a working environment for a patient-physician consultation. So this is a hub which is in towards clinical trial with an academic institution out of Canada this year, and we will be able to deploy those products out into scale production early next year. The wearable that we have is part of a clinical offering towards a therapeutic for a specific condition outcome. So this removes the requirement for a physician to manually take information in, to write it down, to get that reading right, or for anyone to take that reading and enter it into another platform. This automatically comes in through the wearable into the platform, and it offers the 5 vitals that are critical, especially to an ongoing or chronic illness using patient. And it's all intertwined and it's all connected and it's all continuous. So that ecosystem is highly complex. I won't go into the details of it. And this is coming out later this year and early next year in a sequence deployment. But you can see how through the capture of real-world evidence, IoT functions, Internet of Things, captures a continuous omni-channel or multiple different data set around health, around activity, and puts that in through to the clinical software via interoperability functions of FHIR and HL7 into the hands of a treating physician. It is virtual care, it is continuous, and it is totally and utterly scalable. So how that comes together is through the expansion of the relationship via a corporate. We're an enterprise software. So when we engage with employers, we help coach behaviour change and health improvement at scale via a population. That population has a very close working relationship with insurance and they're understanding risk. We offer targeted solutions through our personalisation algorithms out to then connecting with virtual care. And that ultimately at scale is a government proposition. Now currently in 30 countries, we can go very broad to a relatively, and I say relatively unregulated space of wellness, and then into the more regulated space of care into the markets that we dive deeply into. From a corporate perspective, the focus for us is on acceleration. And the pandemic in particular has identified that sleep and mental health is a core determinant of your immediate health profile. And for that reason, Wellteq is in the very late stages of closing an acquisition of intellectual property around sleep technology and triage and coaching programs, and also which also accelerates the R&D towards the remote patient monitoring or the remote clinical offering through our extended continuum of care. Our momentum as an organisation is set. It is strong. We have fantastic SaaS revenue year-on-year growth, up to 120% from last year, and we're an annual revenue of just over 1.5 Canadian from FY financial year 2021 ending 30 June recently. So we've got great momentum, and we're about to unlock new revenue streams. So to date, we've had that revenue come in through SaaS for our corporate wellness offering, which is not clinical. It is not the clinical offering. We're about to work with and release our API, so we can now offer our API services to other institutional providers. So rather than a telehealth company being a partner for us purely for a user extension of utility, now we can offer our services via an API into a telehealth company, enabling them to offer wellness capabilities through their application rather than immediately through ours. We have a SaaS bundle, which is a clinical offering, integrating our hardware and software, again maintaining those high 70+% gross margins. And then we have a marketplace of partners such as Garmin. We can offer telehealth services or blood pathology assessments or other marketplace goods and services, such as our corporate partnership with ClassPass, the largest virtual and fitness network on the planet. The growth drivers and current focuses for us are to unlock new revenue streams and to accelerate those current revenue streams of the enterprise offering into employers and into insurers. We launched into the public markets in March this year, so we've only been a publicly listed company for just over 4 months. Since that time, we've had high shareholder communication, we've had great use of capital, developing new partnerships, expanding our team with leadership, and imminently about to launch these new revenue streams. Our next priorities are in and around expanding that marketing and sales investment for accelerated revenue growth, creating new enterprise accounts, and launching our IoMT and API service offerings. The team that we have is led by our chairman and Dr. Peter Vaughan. Dr. Vaughan has an extended history in healthcare and in corporate, having been the Deputy Health Minister of Nova Scotia, having been the former CEO of WebMD in Canada, a former surgeon himself with a medical background, and is currently the chairman of Health Infoway Canada, the way where federal government is investing to bring digital transformation into Canadian healthcare. We have a financial expert in Jacqueline Yee, having worked across the world in managing and growing and investing through healthcare assets specifically. We have Brian Leaners, the founder of the Internet of Medical Things capability as an executive director in the business, and recently welcomed Andrea Johnson from a legal background specialising in small to mid-cap tech M&A companies, also on the board of Denton's Law in Canada. Our leadership team is equally as powerful, with our medical officer based out of Texas, and having been working at a populational and epidemiological level, I'm very involved in the United States, or aspects of the United States management of the COVID pandemic, specifically with the Western Seaboard. We have Andrew Karakesh, a data scientist running a data-driven product, which is very important. We have James, an ex-semi-professional athlete, whom I've worked with for over a decade in this space, and Daniel is our CTO, who has helped design and build software and hardware solutions for Fortune 500 and bleeding-edge technology startups. And lastly, we have Ollie Bridge, who has been the sales lead for what is the largest corporate health company in the world. It was acquired by Virgin Pulse, now roughly a $2.5 billion company, and Ollie helped lead as the sales director the geographical expansion of their business development unit to over 180 countries. We have the best. Almost in closing, we're seeing that the opportunity within healthcare becoming digital is out there and up there with the best available. We've got this dispersion happening through necessity and through need, and we're seeing this being demonstrated by the early movers in some very big corporate activity. We've got brands like Microsoft, we've got brands like Teladoc and Livongo and Amwell coming together, and we've got SPAC mergers in the early billions of dollars. And this is exactly the space for huge opportunities. So where Wellteq comes into this is that we are at the very, very best end of the scale for appreciation. Our peers are multi-hundred million and multi-billion dollar players, and we have points of difference and unique offerings compared to all of them. We are a ticker on the Canadian Securities Exchange, WTEQ. We have an EV of almost as much as our annual revenue. So our price at the moment is just under 10 cents Canadian. We have an extremely strong balance sheet, over $7 million in cash, which is fueling both our operational expansion and our inorganic expansion via M&A. And we have aggressive momentum, which is fueling even more aggressive targets and outcomes for this year. So our ROI potential on roughly a $2 million EV with a strong balance sheet is fairly undeniable. I realise that it's a very competitive time for attention at the moment, especially as it's the summer days. So for everyone that is there, I really appreciate your attention. We'll probably have time for one or two questions, to open it up to the floor. So if there's anything I can help with around our mission, which is to coach people towards better health and bring a proactive, sustainable healthcare to the world, I'd love to help with any question. Okay. I've got a couple of questions here, so I'll pick the ones from the top. The recent announcement around our relationship with Northern Trust, so those, especially from the US territory, Northern Trust is one of the largest, I think the fourth largest financial institution in the US. Wellteq has signed a global master agreement for 5 years to be the digital wellness provider, and we're starting off with 4 countries in Asia Pacific. So a huge brand with a global vision. We're engaged to deploy our platform out to their audience, and I think they have just over 20,000 employees at the moment on the whole team. In your presentation, you talk about telehealth relationships. Can you describe what those look like, and has that initiative started? So telehealth is a pivotal part of this escape from sitting in waiting rooms and sitting in front of doctors and surrounded by other sick or ill people, let alone the efficiencies. We work with partners to help extend accessibility to healthcare from a wellness relationship and escalate by triage into a virtual relationship. Via our API services, they're also becoming customers. So that API is now available for telehealth companies to leverage our capabilities inside their environment, so they become both partner extensions for services, but also customers. I'm not sure if we have time for any more. While we've got the audience, what makes the company unique and different compared to your peers? So thank you, Robert. We have essentially 3 big USPs. Number one is that we are, from Asia out to the rest of the world, already global and international and accelerating our geographical reach. Number 2 is that we have the pure digital proposition out where we're not holding big accounts. We maintain an exceptional gross margin of 70+%. And thirdly is that we're the full extension of care from wellness all the way through to care, and we're offering repeatable, highly profitable and highly flexible payment methodologies. So the revenue for us is multiple revenue streams on a global scale, expanding the full continuum of care in a digital format. Okay, the last one, very thank you. It's a great compliment to be compared to the early stages of bringing digital transformation to health and the likes of Well Health, and do we aspire to be a Well Health. In ways, we're bringing hopefully the value to the healthcare system that Well has demonstrated across Canada. Very kind to compare some of my approach to Hamid Shabazi, their CEO, but we are on that path. We're certainly not there yet, but we've got the acceleration possibilities that they have brought. So absolutely, we are in the way of value creation to go from single cent market caps of what they did years ago and where we are now into a soon to be a multi-billion-dollar company. They're on great trajectory. So yes, I think we absolutely have that potential and very near term as well. So I think for everyone that has heard this presentation, I really again appreciate your attention. The content is available for review, and if there are any questions or requirements for further information, Wellteq Digital Health, we are CSE listed under the ticker WTEQ. We are OTCQB listed under WTEQF. You can reach us at ir@wellteq.co on email. Again, I'm very grateful. Our team is very proud. We're very excited. And I'd like to thank SNN as well for pulling together such a potent, very powerful audience. For everyone, thank you very much. I wish you the best out there for your day and the rest of your summertime. Thank you.
Ladies and gentlemen, that does conclude the Wellteq presentation. Thank you for joining us. You may now disconnect.